All right, class. My name is Michael Mata, and I will be going over my community intervention poster presentation with you guys. So let's get started. So my community health hours were done at Arbor Glen Care Center, which is a nursing home in Glendora, California. Some of the health-related problems that were identified there were the development pressure ulcers, pneumonia, dehydration, and UTIs. Some of these problems were identified through working at one of the ER or working at an ER, and when nursing home residents come to the ER, these are the most common issues that we see. So helping to put a stop to this and prevent this would be a very good aspect within the healthcare setting. So a little background and significance. Pressure ulcers continue to be a frequent and preventative problem within the nursing home subdivision. The prevalence rate is 7.9 to 83.6% internationally. Pneumonia is the second most common infection in the nursing home population and accounts for 13 to 48% of all infections within the nursing home setting and is attributable to malnourishment, diminished cough reflex, and impaired functional ability. Also, dehydration is one of the 10 most frequent diagnoses reported when older adults are hospitalized, and the reason 65% of older adults from residential facilities are admitted. And lastly, urinary tract infections are the most common infection diagnosed in the nursing home and nursing home residents. And according to one study, 100 of 266 residents are suspected to have UTIs. And so pressure ulcers, pneumonia, dehydration, and urinary tract infections are health-related problems that are preventable within the nursing home setting. From the information provided, prevention and reduction of these health-related problems is going to be the identified goal. So, Healthy People 2020 objectives. The objectives that coincide with the health-related problems is going to be one of them is going to be health-associated infections. Basically, the objective is to prevent, reduce, and ultimately eliminate health-associated infections, which include catheter UTIs, surgical site infections, and bloodstream infections, and pneumonia. And so UTI and pneumonia is obviously going to fit into that category. Nutrition and weight status. The goal is to promote and reduce chronic disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weights by reducing health risks, which include but not limited to malnutrition. So obviously dehydration is going to fit into that one. And lastly, older adults. So the goal is to improve health, function, and quality of life of older adults. And so pressure ulcers are going to fit into that category. Our needs assessment. The needs assessment was guided through interviewing key stakeholders of the facility and through research of common preventable health-related problems within the nursing home sector. Key stakeholders included certified nursing assistants, LVNs, and RNs. The health belief model was a theoretical framework that guided the needs assessment so we could help identify barriers. And so a little background on the health belief model. So the health belief model was proposed in the 1950s to describe why some people who are free of illness will take actions to prevent illness, whereas others fail to do so. The model was developed to help guide healthy preventative measures for those who are at risk. Also, individuals will take action if two conditions are present. The first one is that there has to be a perceived threat to personal health, and the second one is to protect health. And the second one is the individual is convinced that the benefits of taking action to protect health outweigh the barriers that will be encountered. This model was chosen and guided this project because perceived barriers and benefits are the most powerful dimensions of the health belief model for preventative measures. If individuals understand their barriers, then change can occur. Issues. So the population at Arbor Glen Care Center need to have proactive behavior and ask for assistance in turning and repositioning, cough and deep breathing, asking for water fluids, and assistance with eating. The population needs to have information regarding preventative strategies for health-related problems identified and complications associated with the health-related problems. Resources needed by the population are going to be access to fluids, call lights for the turning and repositioning, cough and deep breathing, and staff who will assess and attend to the population when they are in need. The resources are currently available at no cost. They have staff, call lights, water pitchers, and everything they need in order to meet the needs of the population. However, there are barriers. The barriers that exist are going to be patients who are confused, and which leads them to being unable to drink fluids and reposition themselves, cough and deep breathe, and ask for help in general. So some other additional barriers include cultural differences, psychological disorders which cause noncompliance of care, and also comorbidities, which is going to alter the physiological response of the health-related problems. Some services that are currently available are going to be educated staff, call lights, turning and repositioning alarms, water pitchers, and hygiene teams for perinatal care. Sorry about that. So interventions. So for the health-related problem of UTIs, that coincides with the Health-Associated Infections Objective, 2020 objective. And so interventions for UTIs were basically to encourage the population to provide perinatal care to self with antimicrobial soap and wipe front to back. Also encourage them to drink plenty of fluids, empty their bladder regularly, and pass bowel movements regularly. If they are unable to do the following, they need to ask for assistance. For pneumonia, the 2020 objective was health-associated infections as well. Interventions was to encourage the population to turn and reposition self every 2 hours, cough and deep breathe, drink fluids, and eat nutritious meals, lay in an upright position, and ambulate if possible. Also, they need to ask for assistance if they are unable to do so. Dehydration. The 2020 objective that coincided with that was nutrition and weight loss, which basically the intervention was to encourage the population to drink plenty of fluids and also ask for assistance. Lastly, pressure ulcer. So the 2020 objective for that one was to improve health, function, and quality of life. The interventions for pressure ulcers were basically to encourage the population to turn and reposition self every 2 hours, drink plenty of fluids, eat nutritious meals, and encourage the staff to utilize devices to reduce pressure, ulcer, and shearing. And also to encourage the staff to monitor and treat the wounds appropriately. Let's see, education strategies. So face-to-face education sessions and handouts about the health-related problems that were identified and preventative measures, as well as complications with the population was done. We also demonstrated on how to properly turn and reposition self every 2 hours, how to drink fluids at the bedside, cough and deep breathe, eat meals, what portions of the meal should they focus on if they have a low appetite, and how to wipe front to back. Budget and logistics. So I felt that the existing budget was actually sufficient to meet the needs of the population at Arbor Glen Care Center. They held regular in-service meetings to educate the staff on current problems and trends within the healthcare facility and to help meet the needs of the population. And they also continued this training and service meetings for reinforcement whenever it's needed. And so project evaluation, design, outcome, and measurement. So basically the goal and objective was to increase awareness, provide education, and decrease the prevalence of the health-related problems that were identified. And so to measure the level of outcome is basically measured on an individual and client-focused level. And so to measure the effectiveness of the outcome through the individual-focused outcome level, we measured the effect of healthcare interventions on a biologic and holistic level. And so with the biologic and a holistic level, we're able to measure short-term and long-term, host or evaluate long-term and short-term evaluations. And so for short-term evaluation, for example, this, like I said, this is going to be on a holistic level approach, and we would assess knowledge, lifestyle change, functional status, psychosocial functioning, perception, self-care, and quality of life. And so if we see that the residents at Arbor Glen have a better attitude about wanting to be turned and repositioned, have a better attitude and actually want to be repositioned, to drink plenty of fluids, and take action in the interventions of these health-related problems, then we know our short-term evaluation is going to be good for meeting their objectives. So for long-term, we would use a biologic outcome approach in which we basically assess like body weight, vital signs, something that's measurable. And so we would assess pressure ulcers. We would see if they're improving over a period of time or if they're getting worse. We would see if the rate of UTIs and pneumonia goes down. So that would be more of a long-term evaluation on a through a biologic approach. Resulting conclusions. Whoops. So to help to meet the Healthy People 2020 objectives, education and preventative measures need to be implemented to reduce the prevalence of the health-related problems identified. And so I felt that there was really no weaknesses within this intervention. I felt like all the education for preventative measures was effective. The staff and the residents knew and understood what needs to be done in order to help kind of decrease the prevalence rate. So I really felt there was no weaknesses, but for future suggestions, I would just continue to provide education, increase the awareness of what's going on with these health-related problems, and basically just help increase knowledge overall and continue to educate. And my references are actually listed right here. They're actually pretty small, so I made a second slide, which is this one, which is a little more visible. And that pretty much completes my presentation. Hope you guys enjoyed. If you guys have any questions, feel free to ask. And thank you for listening.